Yes, good morning. My name is Matt James. I'm Director of Communications and Engagement at WellChild, the national charity for seriously ill children and their families. Welcome to today's webinar, which is also brought to you in association with the North and South Thames Paediatric networks. I hope everyone's well. We've got a pretty decent turnout today, and we've got a first-rate lineup as well in terms of panelists this morning to discuss what is one of probably the hottest topics at the moment for families caring for a child with serious health needs and disability, and that is going back to school. The date is fast approaching. So we've had hundreds of questions sent to us, and we know from talking to many of the families within the WellChild Family Tree Network that this is a subject that many families are struggling with at the moment, from safety fears to what their legal duties and responsibilities are. So we hope that today's event is going to explore some of those burning issues and maybe even provide some direction for you. Before I do introduce the panel, I think it would be good to get a reminder and a bit of an update on what the current government guidance is, especially for families with a child with serious health needs and disability. So I'm really delighted to welcome Minister Vicky Ford MP, Parliamentary Under Secretary of State for Children and Families at the Department of Education. Thank you so much for joining us today, Vicky. We really do appreciate it. If it's okay with you, we'll start by handing over to you, if that's okay, just to give us a bit of an overview on what the current government guidance is, especially for families at the moment.
Thank you so much, Matt, for hosting this event and for everybody for attending this event. And thank you for inviting me to speak and set the scene, as it were. I want to start by acknowledging the enormous pressures that families of children with complex needs have faced during the pandemic at this time. It's always a difficult time. It's always difficult for them, and it's been particularly difficult during COVID. And I am so full of admiration for the parents, the carers, the children and young people themselves, and indeed for everyone who supports them at this very challenging time. I just wanted to set the scene on the return to school. Our intention is obviously that all pupils will return full-time to school, and we're taking this approach because the scientific advice indicates that the prevalence of COVID has decreased, and because of the improvements to the track and trace system. And we are always, and indeed currently as well, seeking that assurance from those health specialists at the Department for Health on the system's capacity to continue to increase to meet demand for track and trace, both at national and local level. We do know that there is great anxiety for some children and their families about returning to school. And we also recognise that some may need specific help and preparation for the changes in the routine that returning to school will involve. I wanted to reassure you that the decision to ask pupils to return to school was not taken lightly. It is absolutely based on the latest available evidence as we all get to understand COVID more. The advice from the Scientific Advisory Group for Emergencies, that SAGE committee, shows that based on the evidence, children are at a considerably lower risk from COVID than adults. It also shows that the risk of transmission in school is low. And when we consider risk to the workforce, international data suggests that teachers are not at an increased risk from COVID compared to the general working age population. So to support the return, we've published guidance for the full opening of both mainstream and special schools and other specialist settings. And the guidance is to support the full opening in the autumn term, and that guidance has been developed with medical experts and provides specific advice on how settings should implement a system of controls to reduce the risk of transmission. I know that you'll be aware, and indeed I suspect everybody on this call today will be aware, that the shielding advice for all adults and children paused on the 1st of August. That's largely because there's so much less COVID present in the population. And therefore, even a small number of pupils and students who were on the shielded patient list will be able to return to their school in September. And I would also reiterate that those children who are under specialist medical care should obviously discuss particular circumstances with their own specialist paediatrician or health need. We also recognise the importance of transport for children and young people with SEND in enabling them to attend their settings, particularly those who are in specialist settings. And when deciding on the package of measures that's appropriate on transport for children and young people with special educational needs, local authorities will need to take account of particular needs of each child and how they use the transport, and be informed by the views of both parents and the school. Local authorities are under a statutory duty to provide that free home transport, free home to school transport for all eligible children of school age. And they remain under a duty to publish a transport statement detailing what travel assistance they provide to young people over 16. And to support this, those involved in the provision of home to school transport must do all that's reasonably practical to maximise social distancing where possible and minimise the risk of transmission during transport. What is practicable is likely to vary according to local circumstances, and we have published new guidance on dedicated school transport for the autumn term this year. I'm particularly aware of the needs of those children who require aerosol generating procedures. And we need to make sure that we have processes in place that protect both the child and the staff who administer the procedure. We want to make sure that the staff have an equal level of protection in an education setting when they're doing a health procedure as they would if they were in a more medical setting. And so the advice is equal in both settings. And we're asking teachers, families and other services to really work together to make sure each child's needs are met. And I recognise that specific care activities such as those aerosol generating procedures are a particular concern to the families who are affected by this. We're very clear that staff performing those procedures should follow Public Health England's guidance and wear the correct PPE. And that's all set out in our safe working in education, childcare and children's social care settings guidance. We've developed this again with the support of Public Health England, and we do expect that in the vast majority of cases, children who require this type of care will be able to return safely to school. We know that during lockdown, most children were educated at home, and that was not the same as elective home education, and children have remained on their school roll and received a combination of support from schools, online learning resources, and other resources provided by parents. From September, all children should return to school, and unlike during the lockdown period, schools will not provide remote educational support to pupils at home when those pupils are expected to be present at school. But we do recognise that some pupils will require support to catch up from being out of school for so long. So we've introduced a catch-up package worth £1 billion, including a catch-up premium, which is worth a total of £650 million, which goes to support schools to make up for lost teaching time. And this funding could also be used for specific support, such as intervention programs, extra teaching capacity, speech and language therapists, education psychologists, and access to technology, or indeed it has been used during the summer for access to summer schools in some circumstances. And it is up to head teachers to decide how this premium is best spent according to the needs of their pupils. But our expectation is that the funding will be spent on additional activities required to support the children as they catch up. The universal catch-up premium is weighted towards specialist settings, and that is in order to recognise the higher cost of provision in those settings to help them to best meet the needs of their pupils. So in terms of how the funding is going per pupil, the specialist settings are getting that extra weighting. Alongside this, we have the National Tutoring Programme, which is another £350 million investment, and that's for disadvantaged pupils. And that will increase access to high quality tuition for disadvantaged and vulnerable children and young people, which we hope will help accelerate their academic progress and tackle the attainment gap between them and their peers. The Education Endowment Fund has published guidance on the National Tutoring Programme on effective interventions which can support this. And our aim is that that tutoring programme should be as inclusive as possible. And it's important that tutors adapt that provision to a wide range of needs. So in selecting tutoring partners, the EEF will look for expertise in working with children who have specialist educational needs and disabilities, both in specialist settings and in mainstream settings. And it's important to recognise that academic tutoring is not necessarily the best approach to meet the needs of every individual pupil, because we always believe that every child must come first. This week, we've also announced a new training scheme for teachers and staff. It's an £8 million investment to improve the well-being and mental health support in schools and colleges. Schools and colleges will benefit from a new training programme run by mental health experts to help improve how they can respond to the emotional impact of the coronavirus pandemic on both students and staff. But in the big picture, we really strongly believe that the benefits to returning to education for children far, far outweigh the low risk that's associated with the virus for children and young people. And as we draw closer to that September return date, we will continue to support children, young people, families and schools to manage the anxieties which come along with this. And I do hope that this morning, the expert panelists that you've got here today will be able to answer many of the different questions that families have, and will be part of that support that we want to make sure that every family, every child can get as they consider the return to September. So thank you so much for bringing everybody together. Unfortunately, I can't stay for the whole session, but we do have experts from the DFE here who'll be listening closely and helping to answer your questions. So what is it now? 2 weeks to go, maybe a little bit less for some before they get back to school. But I do really hope that this return to school is successful, because being in school is so important for all children and young people, and especially for those with extra needs. Thank you very much. I'm going to hand back to you now, Matt.
Thank you so much, Minister Ford, for that overview. That was really useful. It's been great to have you on here with us and talking to many of the families that have joined the call. So thank you so much for that. I know that we're going to have a ton of questions. So what I'd like to do is just introduce our expert panel, and we can bring them into the discussion. So with us today, we've got Andre Mitch, SEN and Disability Professional Advisor from the Department of Education. We've also got Caroline Barrett, Senior Associate at Irwin Mitchell, and an expert in education law, including education provision for children with special educational needs. We also welcome Steve Solomons, who is Head Teacher at Riverside school in Kent, Riverside, is an SEND school that specialises in the expressive arts and prides itself on working closely with families. And we also welcome Rebecca Daniels, who's a community children's matron and Queen's nurse with over 20 years experience in children's nursing. She's particularly passionate about supporting the needs of families and children with complex health needs in all settings. And also we're delighted to have Jill Evans, who's a WellChild parent ambassador. Jill is mum to 9-year-old Noah, who has a very rare form of interstitial lung disease that requires him to have a tracheostomy to help him breathe. And he attends a mainstream primary school. So Jill is kind of living through this at the moment. So welcome to you all. Our first topic, unsurprisingly, which is a pretty fundamental question really, that we've had in from many families, is around safety. Many of the families that are on this call and that indeed WellChild support are caring for extremely vulnerable children. Many have been shielding since the start of this crisis and are continuing to do so. So Sarah from Surrey submitted a question to us. My son has been shielding and is due back to mainstream school in a classroom of 33 children. There's no social distancing as it's within class bubbles and there's no mask. Can somebody explain why I should feel confident it will be a safe environment for him? Andre, I wonder if I could start with you. What reassurance can we give families like Sarah's that it will be safe?
I mean, I think one of the points the Minister was making was that the decision has been based on medical evidence about the risk of coronavirus for children and young people, and that is something we didn't know a lot about when we went into lockdown in March. It was very early, it was a whole new experience for everyone in the world, let's face it. We have learned an awful lot in a relatively short space of time. And one of the things we've learned is that children and young people are, the data very clearly shows them to be a group who are at very, very low risk of contracting coronavirus. We also have to recognize that, of course, schools are populated by adults as well. And again, the evidence shows that teachers are at no more risk as a profession from coronavirus than any other group of individuals. So putting that together, we did feel it was very important to put that together and ensure that the return to school happened as soon as possible, because the benefits to children of being at school are enormous compared to not being at school. So that was a really important driving point. Let's get children back. But we need to make sure it's back in a safe and reassuring way. And most of our guidance about any aspect of the coronavirus continues to emphasize the system of controls to schools. We have provided schools with considerable guidance about how to make schools a safe environment and to reassure families that they are a safe environment. And the system of controls is something that schools are required to put into place. And we have worked with school leaders consistently over the last few months to get a shared understanding of what they are, so that children can go back in September and feel reassured. So I think that we are doing our best in the face of a very challenging situation. We're listening to medical advice. We're also listening and working with our school leaders who absolutely want to make sure that they are providing as safe an environment as can possibly be done at this time.
Thank you, Andre. And actually, talking about school leaders, obviously, it seems an opportune point to maybe bring in Steve, actually, and understand from you, Steve, on the ground at your school at Riverside. I'm sure you've got many families with similar anxieties to those on this call. What's your school doing, and what reassurance can families get from the schools that they're at?
Yeah, absolutely. It's a great question. And first of all, can I thank you for inviting me to join what's been billed as an expert panel, and great to be sitting with such a wise and eminent team of colleagues. But what I would say to our families is that, you are the real experts, and you're the people that have shaped your children into unique and courageous and charismatic people. And in these really challenging circumstances, you are doing an incredible job. So I think it's important to say that from the outset. In terms of safety, I guess it's fair to ask whether anywhere really is 100% safe or risk-free. I think our job in schools is to introduce measures, as Andre has alluded to reduce risk as much as we possibly can. And like schools up and down the country, we've introduced things around bubbles, making sure that the sizes of teams are appropriate to ensure the curriculum can be rich, but to ensure that safety is paramount, and maintaining consistent staffing and managing carefully the people that are coming into the school and that are working with our children, increased cleaning protocols as you'd expect, and sanitisation, and also working with colleagues from SEN Transport, which I believe the Minister referred to earlier, to ensure that entry and exit points can be as smooth as they need to be. I guess one related point also, Matt, if I may, is a question that parents have asked is with regard to safety and why should they send their children back? You know, what will school look like and what will school feel like? And I guess each school has its own distinctive feel, but I think there should be places of joy, of belonging, of connection, of laughter and happiness, and regardless of those current challenges that we know everybody is facing, those clear aspects of education and schooling should, in my opinion, continue.
Thank you, Steve. And thinking about families who are worried about this, what would you recommend they do in terms of reaching out to in terms of preparing to go back?
I think the communication, it seems an obvious point, but it's true, has to be very, very open and honest and transparent with schools, whether that's the same code, depending on whether they're mainstream or specialist, with the local authority, and also clearly with those medical professionals that are also very involved in their child's care, to relieve some of those anxieties where possible. So to keep those communication channels open, honest and transparent. We know that every child is different, every child is unique, and they will each have their own needs, hence the need for that clear and open communication.
Thank you. Rebecca, I might like to bring you into this point actually. Safety is obviously a big concern. As someone who works with families every day on some of their health needs, what reassurances can we give families, and what's your perspective on this issue?
I mean, I absolutely understand family anxiety because, you know, especially for our children who've been home for such a long time and they've not been mixing, and, you know, they've been so protective. I think what is really key is the evidence that does show that actually the transmission is low in schools, and we know that the safety measures have been put in place, and where there has been kind of testing research done in schools during COVID, that the percentage of any child testing positive has been minimal, if to none. So I think what it will be very much about for that reassurance, as Steve has said, about that open communication, will be about looking at individual risk assessments for our children and kind of linking in with the schools, the health professionals, you know, the specialists as well, definitely, to kind of get that go ahead from the specialists, that reassurance that actually, because I can see a lot of the questions that are coming up from the participants today, is around how is it suddenly safe, and so we need that discussion with the specialists as well, and do those individual risk assessments to look at what the current health needs are, what are the interventions that are required, what's the school environment like, because we know that there's a mass variation between special schools, inclusion in mainstream, resource provisions, and all of those will come with their own challenges, the social bubbles, and I think the transport is a really big thing as well. It's about us all working together and hearing what the families say. And I think taking our time to do this and not rushing into it, I think that would be my kind of perspective, is working with our schools and our families, is we need to work together to look at a holistic approach for each individual child to make sure that it's safe and it feels safe for the child and the family, and that it's something that we can work together with the schools and transport to do.
Can I make one further point? Throughout lockdown, most schools had some children in. Schools like Riverside, pretty much every special school in the country was open and had some children in. Some special schools had up to 50% of their children in. Some mainstream schools had quite a number of children, some with special needs and some without, in. By July, there were about 1.5 million children who were in attendance, if not full-time, then part-time in schools. That was a positive experience for those children. It enabled us to learn much more about how to accommodate their needs, and it helped schools prepare for the changes to the environment that they would need to make for September. So opening in September isn't quite what's happening, it's expanding what's been happening. Many schools have been open to some degree so far, and there's been an awful lot of learning, and I think we we can be reassured about the experiences of the 1.5 or more million children who experienced school in the last few months.
And if I can just further add to that, to Andre's point, as you said, many schools up and down the country from March have been open, and ourselves at Riverside have been from that period through the holidays as well. And from June, we had approximately 70% of our pupils back. Now that's based on relationships with families, and I guess trust and families feeling safe in sending their children back. Although, as I said earlier, it's not a one-size-fits-all model. We also run a play scheme, which is a slightly less formal environment. And I guess the point is, it can be done. It's tough, but it can be done.
Exactly. Yes.
Thank you. It feels like communication is what it's all about, and at a very early stage with everyone involved. One issue which I was really pleased to hear Minister Ford mention in her opening remarks was around aerosol generating procedures. I know this is a big concern for a lot of the families that WellChild supports, but we've also had an awful lot of questions in around this, and it does tie into the whole safety issue. There's been some media coverage on it, I know, and I believe there is an online petition that's had over 3,000 signatures on this now. I'd like to bring Jill into this, because obviously Noah has a tracheostomy, Jill, and thinking about the discussion we're having around safety and thinking about going back and the anxieties people have, it'd be interesting to hear from you what your concerns are around the management of ADP and in school at the moment.
Sure, yeah. I mean, Noah has his tracheostomy. He also takes a ventilator with him in case he needs it, and oxygen. He's in a mainstream school, so he'll be sat with his 30 kids in class. Currently, how it stands, if Noah was to need a suction because he can't cough as other children do, he would need to go with his carer and all of our equipment to a totally separate room, which may not necessarily be next door. It might be down the hall, round the corner, take a little while to get there. Once he's there, then the carer has to don full PPE. So it's not just a quick mask and gloves. It's like, you know, totally covered, face shield and everything. And then do said procedure, whether it be a tube change or whether it be a suction, whatever. Now, generally, when certainly Noah, lots of our children need this procedure, it's right then that second. You know, it isn't in 3 or 4 minutes that it's going to take to get there. Also, once there, let's say everything's okay and they get there and manage to get changed, everybody's then got to wait an hour, I think the current guidance is, for said particles to dissipate, and wait until then they can return to class. Yet some of these children, what if he needs a suction at 9:30 and then one at 11:30, you know, is then spending numerous hours in some small room, not really getting that teaching that he's needing. So it's just really confusing how it's actually going to work out to keep the safety of all of the class, and Noah's safety as well, to make sure that he gets that procedure in time.
Thank you, Jill. I think this is clearly an issue. We had a question from Victoria in Hertfordshire on this, and the question was, what is actually being done to ensure that the guidelines are more applicable and achievable by schools as well? Because I think this is one of the key issues, is actually the guidance for schools and supporting the schools. Andrea, I wouldn't mind getting your thoughts on are we likely to see sort of guidelines on how schools can accommodate procedures such as AGP?
Yeah, I mean, I think at the moment we've produced guidelines and people are trying to implement them, and we can understand the concerns that Jill has raised. Again, the Minister was, I think, rightly keen to make sure that in managing this very tricky situation, we are considering the needs of the staff who have to administer as much as we are the children. They have equal rights to protection and to minimising risk. And again, we also need to take our lead from what's happening with health professionals administering similar forms of intervention. So we have to tread carefully with this one. And of course, the implications are those that Jill has spelled out, and I'm sure that Steve would reinforce about the challenge of implementing within a school environment. But again, let's go back to that point about learning from experience, which we have done since March. This is something we need to work on together. The Minister was emphasising the need for families and school leaders and teachers to work together on these solutions. We're going forward into September. We need to implement the guidance as it's spelt out, and we recognise that that's going to be different from one setting to another. The environment in a school, schools are very different, and so on, and the people involved are different. So the solution will be slightly different from one setting to another. The aim is always to make sure that the child is safe and protected and intervention delivered as rapidly as possible. And I think after a few instances, people will learn, and I'm absolutely convinced people will feel reassured. It's stepping into the unknown that I think is quite a challenge. But we need to work together. And I can't guarantee, but I suspect that we will produce different guidance and so on soon afterwards, once we've learned more about the actual implications for putting it into place. I don't know if Steve or Rebecca want to add to that. I mean, I just want to emphasize, we are aware that this is probably one of the most challenging issues in relation to children with additional needs at the moment.
Simon, I'd be interested to get your perspective actually. How easy is it for schools to accommodate the needs of children who rely on these procedures? Is this something that you have to manage?
At Riverside we do. We have a number of children, for example, that require regular suctioning. We're working very closely with our healthcare colleagues currently to ensure that their classrooms are safe. We understand that, as I said, different schools have different procedures. We don't want our classrooms to seem overly clinical. We don't want children having to be removed from a classroom to a small room in order to have any sort of intervention. And our kind of curriculum is based on that very holistic approach to meeting those needs, whether they be education, social, or medical. So we are used to that. It's just a matter of looking at which staff would be administering which medication, how we do that in a seamless and safe way, protecting our pupils and other children in the room, as well as our staff. As I said, it's based on those relationships with healthcare colleagues, and we are confident that certainly from Riverside's perspective, we will be able to meet those needs in a way that doesn't compromise the dignity of the child, keeps them safe, but keeps them included in an environment where they do feel part of that class and part of what is going on a day-to-day basis.
Thank you. And Rebecca, just sort of bring you in here on the actual health needs and someone who understands the procedures themselves. What is it that do you feel needs to be done and to both support the schools but also sort of reassure parents on this?
I know Vicky mentioned that there is some guidance around AGPs, but it's very focused on tracheostomies. It doesn't talk about ventilation, doesn't talk about all the other, what are we actually classifying as AGPs? And I think, as community nurses, we've had to set up a forum because we're really, really passionate about the fact that we don't think the guidance is clear enough. We don't think it's specific enough in terms of, and we don't think it's realistic as well in terms of, I understand what's being said in terms of translating what we're doing in the community into the education settings. But the reality is these children are at home. Their carers are probably wearing a basic surgical mask. They are integrated within the family environment. They're not being separated. And what this guidance is suggesting is that we're asking these children to go into school, either be separated from their peers or have staff in full PPE head to toe. And the full PPE head to toe is if there's a COVID positive. Now, we're making an assumption that these children are actually well and they're not COVID positive. So actually, I'm suggesting that the guidance needs to be reviewed to look at actually, why are we treating our children differently? Because the children who are coming into mainstream schools are, any child who doesn't have aerosol generated is going to be coughing, could be sneezing, and the staff are not going to be wearing masks with those children. So it really, for us, we really want to see equality. We want to see our children with complex needs treated and having the same experience, and not penalised for having aerosol generated procedures. I think it is really tricky, and as professionals we are really working hard. We are lobbying to try and get clearer guidance to say that this is, it's very hard to translate what's happening in the community or in the hospitals into the education setting, because most school staff are not wearing masks. Whereas you walk into any health centre and everyone has to wear masks. So we've got two different levels. And I think I just want to say to parents that we are really trying to do everything we can to try and make sure that your children can go back to school. I think it will be about kind of us continuing to work together, and trying to do this slowly and get it right, definitely. But the children should be in their mainstream classroom. And as Jill has alluded to, the guidance currently says that a child with a tracheostomy, if they need to have suction there and then there should be no other children around. Well, that doesn't work in a mainstream class of 30 children. How can you remove 29 children without it being disruptive? Some children can need suction 4 or 5 times an hour. And that's the reality that the children are facing and that we are trying to work with. And I think it's also really important to recognise there is different variations. The guidance on aerosol generated is that any child who's on long-term ventilation that's an aerosol generated procedure. So that this guidance alludes to that child can't even be in a mainstream classroom. So there is so much for us to consider. And I think we really, really need the government, the professionals, Public Health England, to really listen to what community nurses are trying to say. We're trying to lobby it with the parents to get more clear guidance that actually is workable in a school environment.
Thank you, Rebecca. I'm quite keen to bring Caroline at this point, actually. One thing we've seen is we've heard from families where schools have kind of said, particularly those in mainstream schools who may not be geared up to follow the guidance around AGP. So in circumstances where a school is unable to meet the needs according to government guidance and a child is told, which we know some have been, that they can't come to school, what is the legal position on that, and actually what should parents do?
Well, it's a really difficult situation, and I'm very conscious that I'm speaking just as a lawyer, and I'm not here trying to implement these things on the ground and actually follow guidance, which, as Rebecca has said, is actually quite difficult to implement in a practical sense. The provision that's in a child's EHC plan, there's a legal duty to provide it. So that includes the provision that's in Section F, which is your special educational provision, but also Section G, which is your healthcare provision. And I'm sure for the vast majority of children, obviously, that require AGPs, there will be processes set out in their EHC plan, which sort of set out how often they might need to be suctioned, or how, the extent of medical support and input that they would require. And if practically you can't deliver that in a school setting, it effectively means that you can't receive the provision that's in your EHC plan, which would make attending school very difficult, and would mean that your child's needs couldn't be met in school. Now, I'm saying that, I think it all comes down very much to individual circumstances. And so, for example, Rebecca, you were saying that some children might require suctioning several times an hour. Well, if that's the case, and for every time that happens, they're in a separate room, they'll never be in the classroom, which means that, there's no practical way for them to attend school in reality. So I think the going back to school guidance does recognise that some children, for clinical reasons, still won't be able to attend school. So I think the first port of call would be to speak to your child's paediatrician or doctor or their medical specialist, and get their advice and their professional opinion on whether your child is going to be able to go to school if that's the case. And if they can't, if the clinical advice that they can't attend school, then the guidance provides, obviously children won't be penalised for that, and schools will have to make alternative arrangements to provide them with remote education at home. But I'm saying this, I know there's no easy solutions to this, because ideally, children shouldn't have to be separated from their peers and be at home and the rest of them are in school. But hopefully, as Rebecca says, as this starts to be implemented on the ground, some of this guidance will be updated to kind of, be more realistic about how this can be provided in school.
Thank you. And I think this touches on a conflict that I know that many of our families are facing at the moment, which is between what is their legal duty to send their child to school versus the need to protect their child if they don't feel it's safe. And I think this is something that a lot of the questions families are wrestling with at the moment. One question we've had is from Samantha in the West Midlands, who asks, what actually are the kind of consequences of not sending my child to school? Although we're desperate for a break, we don't want to play Russian roulette with our daughter's life. Caroline, if I can maybe just come back to you on that. What is the legal position for families here if they are anxious about sending their child to school? We talked about the school not potentially being able to meet the needs, but also there's this other issue around families actually feeling too anxious to send their child to school. What is that position?
The legal position as it stands is that the government has said that from September all children should be back in school, and that if parents have a legal duty to send their child to school, and if there is schools then have a duty to report to the local authority children who don't attend. The legal consequences of that are that for children who don't attend school regularly, the local authority has to report that. The school has to report that to the local authority, and the local authority can issue fines to parents. So that's the ultimate consequence of there being long-term absence from school, is that parents can be fined. The government's confirmed that fine process will be back in play, as it were, from September. So children are expected to be back in school, and ultimately, if they don't go to school, a fine could be at the end of the road. That being said, as I said before, the guidance does anticipate there being some circumstances in which children might not be able to come back, one of which is local lockdowns, in which cases schools are going to have to have their own procedures for which children should be in. If there are local outbreaks, then some children might need to be shielded, or family members might need to be shielded again, and in those circumstances children wouldn't be penalised for going. And the guidance does also recognise that there might be clinical reasons why a child might not be able to attend. And as I said before, that starts with you speaking to your child's doctor and seeing if it's safe for them to attend or not. And frankly, that applies regardless of COVID. So if your child ever has a serious medical condition, even if it's short term, which means they can't attend school, then alternative arrangements would have to be made for them to receive education at home. So that's the kind of formal legal perspective. There is, of course, a grey area, which is just anxiety about returning to school, children might not being able to return straight away, and there needing to be a bit more of a gradual transition back to school. Schools are carrying out risk assessments for all these children that are returning. It is anticipated that some children with complex needs might not be back full-time straight away, that there might need to be a gradual process of helping them return. And so I think for all these things, if you have concerns and anxiety, hopefully the school that your child is attending will be able to speak to you about this and allay concerns. And if you have medical concerns about them attending, then speak to the doctors. So there are some caveats to fully returning to school, but it's just that the general position is that you should be back in school by September.
And I'd just like to bring in, we're very conscious of time. It's amazing how we could probably talk about this all day, actually. I'd just like to bring Andre onto this, actually. There's clearly this conflict that parents are feeling between the legal duty and the yearn to protect their child. Will families be fined? I mean, because of safety concerns? I mean, what's the Department of Education's perspective on this?
I think Caroline spelt out the whole position very nicely, and I wouldn't disagree with anything she said. But our message to our schools is very clear. Children have had a difficult time for the last few months. It's not going to be straightforward welcoming them back. Some will need additional support and a greater degree of tolerance. And I think our message really is very much about being sympathetic, supportive, having ongoing dialogue. There'll be adults going back to school in September who will have their own anxieties, some of them about return to a full-time existence at school. We all need to work together on this. It's not just parents of some children. As a society, we're all looking for reassurance that we can go back to as much normality as possible. So we are asking our schools very clearly to be supportive to families, certainly in the first few weeks and months of the return.
Thank you. I'd just like to bring in Jill, actually, as someone who's actually preparing to go back and you've got is going through this at the moment. Just keen to get your perspective on where you're at with all this at the moment.
For us, I have two whole situations on my mind. One is the AGP thing, and is it even possible? And the other is the anxiety about going back. I'm in effect still shielding Noah, who was on the very vulnerable list, and we've been out a handful of times and people aren't staying away the distance that I think they should stay away from. So I have both sides. One thing that I would say, just on the AGP issue again, is that I've spoken to our consultant for Noah, and he was very clear that, much as he may be quite poorly, if he gets it, we don't know, he's no more likely to pick up COVID than anybody else. So there's that. So he's saying, yes, go back. However, what happens if school can't accommodate it? If the room that he has to go for suctioning is down the hall and he's not going to be there in time. So it's difficult. I understand all of the guidance and why it is. So yeah, there's that AGP thing, and can school actually deliver it? And there's the anxiety about actually sending him back in the first place. I have another little one as well, a couple of years younger, so I have that he's going anyway. So if one's going, the other one may as well go. But it's tricky.
Thanks, Jill. And just on to Steve there around, obviously you're gearing up for sort of reopening the doors after the summer. What's it looking like for you, and what are you doing to kind of communicate with families? It feels like communication is the all-important message from this session, actually.
I think that's true, and I think throughout this process, schools will, I'm sure, be judged by how well they've been communicating with families from mid-March onwards, including through holidays and summer, which is something that we are very committed and prepared to do. I think, as the point was made earlier, is that September won't be as big a kind of a point perhaps for some schools than it will be for others, and it's a natural progression for children coming back. I think flexibility is key. There has to be a recognition that for some children, listening to clinical advice and guidance is really important, and if continued support is required at home, whether that be providing staff to provide that familiarity, then that is something that we're able to do, and I know that many other schools are prepared to do that. I can see Noah on the side there as well. Lovely to see you, Noah. And in terms of would I advocate families being fined, my personal view would be no. I think we have to be flexible. I think we recognise the challenges that families are under, and as Andrea said, that staff are under as well. Be prepared for September, because all of us want to see all of our children back in school as soon as it's safe to do so.
Really nice way to point with this. Amazingly, we've run out of time, and I feel like there's a whole heap of other topics that we could have talked about, siblings being one of them, what to do there. But I think maybe we may find a way to answer some of the questions that we weren't able to ask, of feeding those back in maybe after this session. I'd really like to thank all of our panelists and to everyone who submitted questions to this Q&A. I'm sorry if we haven't been able to get through all of them in the time that we had. I sort of wish we could have had a few hours on this, but I hope we have managed to address some of the key challenges, at least in some way. It's clearly a very complex issue at unprecedented times, and so much seems to depend on individual circumstances, but it does feel like there's a few key messages that seem to have come out of today, and that is communication, number one. I think an open communication with everybody involved, from schools to health professionals, and really early, and try to bring as many people into that discussion as you prepare to come back. I think come September, a lot of certainly from the discussion today, there may be additional guidance coming out depending on how things go, particularly around AGPs as we feel our way through this crisis. But I think it's clearly a complex issue. So if you do want to continue the conversation, we're hosting a very informal coffee morning session straight after this on Zoom, where you can discuss what's been said here in an informal manner with other parents. It's going to be hosted by Callum and Chloe from the WellChild Families team. The joining details will be displayed after we finished the webinar, and you should also find in the confirmation email sent after registration. I would encourage you to visit the WellChild website at wellchild.org.uk as well to find out information and guidance about going back to school, but also how to find out how you can connect with other families through the WellChild Family Tree, which is a network that connects families right across the country for mutual advice and support. And they've been a wonderful source of support for many families throughout this crisis. Once again, huge thank you to all our panelists today. A massive thank you to our friends at the North and South Thames Paediatric Networks as well for helping us put this on this morning. I'm sure we'll be doing more of this these kind of events, so please do keep an eye out on the WellChild website for future ones. All that's left to say is a big thank you. Good luck with everybody. Good luck to everybody with their back to school plans, and hopefully we'll all get through it okay. Thank you very much.